Hi, my name is Kelly Coble. I'm in Medical Terminology 2 here at Alamance Community College. I chose the digestive system as my project. It's also known as the gastroenterology, which is the study of the stomach, intestines, and the related structures of the stomach. Today we're going to go over sections of the digestive system, describe functions of the organs of the digestive system. We're going to go over a couple of disease and illnesses, common procedures, and some interesting facts. And at the very end of the presentation, I will have attachments for all my research that I've done and all the websites that the pictures and diagrams have came from. At first, at the part of the digestive system, you're going to have your oral cavity and pharynx. The gastroenterology system begins with the oral cavity, which contains your teeth, your gums, your tongue, the hard plate, soft plate, along with the ulva. The ulva is the very dangling back of your throat. The sight, smell, and taste of food is caused from your saliva glands to release saliva into your mouth. Saliva is a lubricant that moistens food as it is chewed and swallowed. Saliva contains enzymes that begin the process of your digestion. We have the pharynx, which is right here, and it allows food to go through your esophagus. The epiglottis is a lid-like structure. It will close so food do not go into your lungs. We want it to go down the esophagus, down to the rest of the digestive system. The larynx, it leads to the trachea. This is also your voice box. That's what you are getting the sound from me from right now, is your voice box. The hard plate is the very top roof of your mouth. We use this with our tongue to smush and move food around. Your teeth. Everyone should pretty much know why teeth are very important. Teeth is very important to take your food and to chew it up, to make it into smaller pieces to be able to digest in your digestive system. The tongue, a lot of people does not know, is a muscle. It is a muscle in your mouth that moves the food around to different sections of the mouth with the teeth to be able to chew, to be able to swallow. The mandible is your lower jaw. And the esophagus is going to be where your muscle connects to the pharynx to your stomach. When you get to your stomach, there are 4 regions of the stomach. A lot of people think we only have 1. There is 4. Cows have 4 also. The stomach is a large, elongated sac in the upper abdomen of the cavity. The stomach is divided into those 4 regions, which is the cardia, the fundus, the body, and the pylorus. Gastric mucosis is arranged in the thick, deep folds of the row. The stomach produces hydrochloric acid, pepsin, and gastrin to aid in the digestion of foods. Now in diagram 2, I got this from kenherb.com, which is a professor on there that actually does study of the stomach. A lot of people nowadays go, oh, my stomach hurts. They're actually holding their intestines. Your stomach is up under your liver. Over here, we have a picture of the stomach. Right inside of this, I have added a mini clip of the rogue. The rogue right here is different wavy parts and worm-like structure that is actually hard skin. This moves like muscles to start taking your food down to your intestines. There also is the pancreas. And the pancreas is actually located right on top of the stomach. This diagram did not have it, so I drew one in for you. It secretes digestive enzymes. The omentum supports the stomach's fatty apron covering the small intestines. This helps to protect your intestines so they do not get damaged. Also, we have the duodenum. The duodenum is very familiar with me that I've had bariatric surgery. Duodenum actually takes your food into from the gallbladder and the pancreas flow. It is a 10-inch shape. The digestive enzymes from the gallbladder and pancreas flow to your intestines to go ahead and start digesting the material. Next, as I mentioned, is the small and the large intestines. If you see here, the small intestines are inside and wrapped with the large intestines. Above that, you have the stomach and the gallbladder, and the liver overlaps some of your stomach. So in this process, you can sort of see a general area of how the food digests for you. The small intestines is also called the small bowel. It is a long hollow tube that receives the chyme from the stomach. What this means is once the acid in the stomach breaks down your food, it's going to go through the small intestines. The small intestines produces 3 digestive enzymes for you to produce to break down the food through your intestines and absorb. Lactase, maltase, and surcase. And then your large intestine or large bowel is a large tube that receives undigested material, some water, from the small intestines. This is material that has not been digested. A lot of times this is your protein, your beans, your corn, your peanuts will all be done like that. Diagram 3 was brought to you by Ultra Crust India. And that's where I also got all this information on the small and large intestines. Intestines in depth. I have a picture of the small intestines and also the large intestines. The small intestine, you see the duodenum, the jejunum, and the ileum. The duodenum is an 8-foot section part of the small intestines, and the ileum is a 12-foot absorbent nutrition where all your nutrition is done. Both of these parts are part of the small intestines, so you have 2 parts to your small intestines. Then you have your large intestines. Your large intestines actually take you down to your appendix. A lot of people hear about appendicitis. That is where a lot of bacterial ends up in this appendix because it does not get absorbed and taken out through the rectum. So your appendix a lot of times get very swollen and irritated with infection and have to be taken out. The appendix does not serve a purpose in your digestive system. Diseases of the digestive system. A lot of times people are worried what's going to happen because you want to eat. That's a human nature. The first thing that we have is called a peptic ulcer. A lot of people have this commonly confused with heartburn. Peptic ulcer is an abdomen pain, symptoms that are accompanied by the ulcer. You are bloated and belching, nausea and vomiting. You also can feel this in your chest, and that's why we feel that pain right at our heart and call it heartburn. A lot of times you can have dark black tarry stool due to the ulcer bleeding. The black and tar is actually where it has went through your digestive system, and it's considered old blood, not new blood, because it's not bright. Vomiting blood is new blood because it's coming through a quicker source and can be visible. Anemia is come from this because when you lose a lot of blood, your blood count goes down and your iron deficiency is in your blood. There is a lot of appetite and weight loss. You don't want to eat because it irritates and hurts the stomach. And again, peptic ulcer are open sores that develop on the inside lining of your stomach, and it's usually in your small intestines. I found a lot of this information on Hostic Health, blogspot.com. This is where I've also got this picture, and if you see everything here, the really light is part of the scope that is done. They take a scope and go through your esophagus to look for the ulcers. This one area that has been spotted out is an ulcer. If you see it, it sort of looks like a pimple, and that's how they determine that it's an ulcer. Tunicle, vectotomy, and crateotomy. It is removable of the distal half of the stomach to reduce the weight of occurrence of a ulcer. It is performed when acid production in the stomach cannot be reduced by any other means. This means you taking Tums, Zantac, Protonics, and another one is Carafate. Carafate actually coats the inside of your small intestines to protect it from any more damage. The purpose of the procedure is to disable the acid-producing capacities of the stomach. It is used when the ulcer of the stomach and the duodenum is not respondent to those medications or a change in diet. Change in diet would include stop eating red foods, spicy, hot foods, spaghetti, tomatoes, any high acid type foods. We all hate to hear the C word, but there is also stomach cancer that can happen. When you may not notice any symptoms, sometimes it is not found until it is spread to other parts of the body. Some of the symptoms to watch out for your stomach cancer is going to be tiredness, feeling bloated or full after you eat just a little bit. We're talking about 4 ounces or smaller. Painful heartburn and indigestion can also be part signs of stomach cancer if there is not a peptic ulcer that is found. Diarrhea and constipation, stomach pain, weight loss for no reason. That means we're not trying to lose weight, we're eating the same amount of foods, it's out of nowhere. Not being hungry is very hard to say because your brain acts as you're hungry all the time. We're human. We see food, our saliva glands start going, we want to taste and try. Bloody and black stool, again, that is stool that is old blood coming out of your body. Stomach cancer treatment. There are several treatments that can happen when you have stomach cancer. A partial or total gastrostomy, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. The diagram that is on the screen right now is actually going to be a partial total gastrectomy. A partial total gastrectomy is where part of your stomach is removed. We hear this a lot when people are doing the weight loss surgery now, where they're doing the gastric sleeve. And that is part of where they move part of the stomach and leave the rest. Only the affected part comes out. Our next is going to be an intussusception. An intussusception I am very familiar with. I've had one myself. An intussusception comes and goes. It usually lasts about 15 to 20 minutes at first. It lasts a few seconds, but every 15 to 20 minutes first. These painful episodes last longer and happen more frequency. Before I knew I had my intussusception, the pain would last for 5 minutes and release. And I will go into detail how that works after we go after symptoms. Other frequent signs and symptoms are stool mixed with blood and mucus. This is where the intestines are rubbing each other and creating blood. And this will be more of a bright blood instead of this black tarry stool because it's in your intestines, so it's more further down and not being able to digest as much. Vomiting. And then also you can get a lump in your stomach, an area where it has started to build up and get infected, and it causes like a swelling sensation, I should say. You could also have diarrhea, and 99% of the time you will have a fever. If you start looking at this diagram 8 that I got from YouTube, it's actually part of a surgery that one of my doctors performed, Dr. Bruce at Bariatric Center of North Carolina. And in this part right here, you can see an intussusception. These intestines right here are in great health. They're very light colored skin, and you can see the blood flow going in. As you start seeing this middle section that's an intussusception, you can see where it looks more bruisy. That is where blood circulation has been cut off, and the intestine goes inside of another. So if you have two pieces of intestine that are connected together, this piece of intestine has went over the second piece. That's how an intussusception works. Intussusception treatment, there is a barium or air enema. Myself, I was not eligible for an air enema because I did have bariatric surgery. But air enema is also done with your smaller children. It is where they lay in this machine. They usually occupy the child with stickers or something like that. There is a tube actually under her rectum. The tube under her rectum has nothing in except it's going to give rushes of air. The rushes of air go in and start trying to blow the intussusception away because it's just a fold. It's just like a balloon. If you blow it, it's going to get bigger. So they have to watch it and monitor every time they blow through this machine. It's sort of like an x-ray. And their intussusception recurs as often as 10% of the time, and the treatment will have to be repeated. If intestine is torn, and if the enema is unsuccessful, you can remove parts of your intestines and it will not affect you. I have had 2 feet of intestines removed myself. The surgeon will free the portion of the intestines that is trapped, clear any obstruction or problems around it, and they will remove any of the intestine tissue that had blood cut off and did not have any more life inside of it. Interesting facts. These are a few cool facts that I found out interesting. The average person produces 2 pints of saliva every day. That is 2 whole cans of soda or 32 ounces. The muscles in your esophagus act like a wave. And when it means act like a wave, we're not talking we're surfing with the wave. It just keeps going up and down, and you have ripple parts of your esophagus. Your body can move your food through your digestive system even if you're standing on your head. So the law of gravity is wrong in this case because it can be done. The small intestines, you would never believe this could fit in your stomach, is 22 to 23 feet long. We are talking 22 to 23 feet. That is about the size of my outdoor building. Do you even wonder why it is that when you pass gas it smells really, really bad? It is because it produces a fermented bacteria and it is mixed with air. That's what gives the nasty smell. My real son really thought that was hilarious because he loves passing gas and making everyone smell it. Well, again, thank you guys so much for watching this today. I hope that you guys got a lot of interesting facts. And also here at the very end, if you can zoom in and look, this is where I got all the diagrams and information and interesting facts for my presentation. Thank you again for joining, and have a wonderful day.